This representative delegates and civil society organizations. It is well known that the Colombian administration have supported and endorsed the war on drug policies for a long time. Nevertheless, the effectiveness of this intervention has been poor, and currently Colombia has become not only a drug-producing country but also has an increasing trend of drug consumption. According to studies performed by the National Drug Observatory of Colombia, the increase in consumption is related to a broadened offer of new psychoactive substances. In responding to this, innovative strategies like harm reduction programs have emerged as an alternative approach to this problem. Drug checking is a harm reduction strategy that allows people who use drugs to know the composition of the samples through chemical analysis. There is evidence that drug checking has helped to reduce the number of overdoses as well as short and long-term adverse health effects of drug use. In line with it, the NGO Accíon Técnica Social and his project Échele Cabeza have analyzed more than 8,000 samples since 2013, causing a positive impact over 100,000 people. Most of the chemical analyses were carried out with a properly reagent testing kit during music festival and another nightlife standard events. As the testing kit is not able to identify neither every single component nor its concentration, Échele Cabeza has been working with the National Drug Observatory of Colombia to improve the detection of NPS in order to enhance the early warning system. During the 2019, the laboratory test detected NPS like catenones, phenethylamines, and ketamines in samples of MDM crystals, ecstasy, LSD, and an emerging drug cocktail called thematic. Drug alteration is constantly changing. Adulterants like synthetic catenones in crystal of MDMA and ecstasy samples represent a real danger. Catenones are psychostimulants with abuse potential and have a vast number of negative effects on different organ systems. The appearance of new synthetic catenones in the market is growing to the possibility of obtaining several of those compounds through drug designing. Furthermore, drug-to-drug interactions and incremental toxicity of this combination is not well established yet. Polydrug use is an extensive habit among people who use drugs. Polydrug is usually performed with the objective of counteracting some undesired effects of any substance for improving the psychoactive experience. The polydrug consumption is normally done sequentially or taken at the same time. However, people can ingest or snort 2 or more substances without knowing due to the common practice of including adulterants during the drug manufacturing by illegal drug makers. The laboratory tests have detected caffeine, MDMA, and ketamine in these samples, and this deserves attention because the specific interactions have not been studied in detail yet. Moreover, other substances can be added to the tusi preparation, making it more dangerous. It is important to highlight that only drug checking with modern instrumental analysis like portable spectrometry, chromatography analysis, and other techniques are needed to detect the real composition of those complex samples as I mentioned above. For this reason, the NGO Accíon Técnica Social would like to invite civil society organizations, private entities, and government to strengthen our drug checking service for generating timely early warning alerts. Colombia and Latin America have a threat related to new adulterants and new mixtures of substances that could be a health problem that cannot be solved with more extensive lists and other traditional machinery taken this far. While drug prohibition has not been able to eliminate either production or consumption, it is time to take care of user needs with new tailored strategies and policies based on evidence until legal regulation exists to allow for safe access. Thanks for your attention.